Hey everybody, it's David Kemp. I'm your host of the Highway to Health podcast series. And man, this is a cool episode that I'm excited to share with you. The Highway to Health podcast series is really about how the healthcare community, the village, is coming together to improve the experience, the access, and the outcomes of our patient population. When you think about healthcare on a broader stage, healthcare is meant to deliver care to those who can't care for themselves. And that's why I'm excited to have Teresa Stivers on the call today, who leads the Walden Family Services. And we're going to talk today about how foster care and foster services are providing the kind of care that our young people need and can't provide for themselves, and bridging the gap for that community to have better access, a better experience, and lead to a higher quality of life and better outcomes for that community. It's a topic that's near and dear to my heart, and I'm honored to speak to one of the experts and leaders in this industry. Teresa, welcome to Highway to Health.
Thank you, and thank you so much for having me here today.
Oh, it's my pleasure, and I can't wait to get into this topic and discuss, the resources that are available, the need and the challenges that are present for this community, and how, if we work together, we can start solving some of the challenges, providing the care and the resources that these families need, and getting your expert opinion on some of these topics. This is kind of a tradition for Highway to Health. I always ask our guests, what do you do? How have you built healthy habits into your busy routine to stay healthy mentally and physically, be available for the people who need you the most? And so if you don't mind, share a little bit about those healthy habits that you've built.
Well, this is actually pretty timely for me because I had a health scare myself about a year and a half ago when I was diagnosed with prediabetes. And diabetes runs in my family. My brother is suffering tremendously. My mother is also. And so it was a wake-up call for me because I am the sole caregiver for my mother. And also I have two children of my own. My youngest is still in college. My oldest can take care of himself, but my youngest is still in college, and, they still need mom. So it was a wake-up call for me to make some huge lifestyle changes. So for me, that meant exercising daily, 7 days a week, no matter how tired I am, how much I want to stay in bed. The first thing I do is I get up and I do my exercise. And then I do a lot of stretching and some meditation. Really to focus myself for the day and all the things that I have to do. Because as you can imagine, as the CEO of a nonprofit organization, my to-do list is really long. And also as a mom and as a caregiver of my mother, I have a lot of responsibilities. And so, but it's also my responsibility to practice self-care. And so I find that exercise, meditation, prayer, and also eating well. So I completely changed my lifestyle and changed my diet. And I also started gardening because research has shown that gardening really promotes mental health and well-being. And so I started gardening, growing my own fresh fruits and vegetables and incorporating more of those into my diet. And it's made a tremendous difference. I have a lot of energy. I can tackle all of the problems that we face at a regular basis here at Walden and also in my own life. And I'm very thankful that I was able to do that I had the opportunity and the privilege to make those changes in my life.
That's a powerful story. And you're right. Taking care of ourselves is our personal responsibility in a lot of ways. And we're dependent on by our kids. I have 4 young ones, and then we're in this stage of life where our parents need us more than they've ever needed us, and it's almost our responsibility to pay them back for being there for us. And healthcare, we talk a lot about it on this show. It's going to take a village. The healthcare professional has to do their job. The insurance companies, the legislation has to do all their jobs, but we have to take responsibility too. And I congratulate you for taking ownership and finding some success. I love how you've incorporated connecting with nature and earth to help improve your health. I'm from Texas. I love being outdoors, hunting and fishing and doing all these things. And there's a mental side of that. There's a physical side of that helps me maintain that physical and mental well-being.
Right. Absolutely. Absolutely. I think that's what we're all meant to do, is getting out in nature every day, even if it's just for a short 15 minutes nature break. I think it's really, really important.
I agree. Well, thanks for sharing that. I know it can be a sensitive question sometimes, so appreciate you sharing your story. Let's get into Walden Family Services. And, as the CEO, there's really nobody better to kind of give the vision and the inspiration behind your nonprofit and help us understand where that came from, where your passion comes from, and then give our listeners a broader understanding of the type of services that you provide to the community that needs you the most.
Yes, absolutely. Well, I've always been interested in the well-being of women and children. Prior to entering foster care about 20 years ago, I worked for the mayor of San Diego, and one of the issues that I worked with her on were policies that reflected the well-being of women and children. It's just something that's just very passionate to me. And then I had my own children, and one of them was born with special healthcare needs. He has a heart defect, he has asthma, he had a whole range of issues that impacted him when he was very young. And we spent a lot of time at our local children's hospital. In fact, I remember the day that we had his 200th visit, I think it was, at the local children's hospital. And he was doing very well, much better than that we had originally anticipated when he was born. And he's doing very well right now, and actually is getting his master's in public health. And I think that's been a part of the process and the journey that he's been along on, because he has had to learn how to take care of himself as he leaves the nest and mom is no longer, around here talking to the cardiologist and all of those people on a daily basis. And it has also given him a passion to help others. But then I reflected on the fact that, I was a huge advocate in my child's life, and was very privileged to grow up with, a 2-parent household with educated parents who could advocate on his behalf. But then I realized that there were a lot of children in our country who don't have that resource. And that's where Walden comes in. And I'm very honored to work for Walden, because what I'm able to do right now is to take the expertise that I learned dealing with my own child's special healthcare needs and help foster children who aren't growing up in the home with their own parents. And many of our foster children are medically fragile with a whole host of issues. It may be spina bifida, cerebral palsy, it may be diabetes, or they may have developmental delays as well. And so Walden then acts as their advocate and make sure that they have all of the resources that they need to become successful adults like my son was. And I'm very passionate about helping these children and being there for them, because as you said, it really takes a village, particularly navigating the healthcare system. You know how challenging it is. And particularly if you don't have resources, if you may not be, a native English speaker, if you may not have the education that I was privileged to have, and now that my son is, with a master's in public health, it's very, very challenging. So Walden employs a whole team of specialists. We have nurses, we have clinicians, we have master level social workers, and we're able to train our foster parents and give them individual training on the specific healthcare needs or the developmental delays of the children that they take into their home, and help them advocate on behalf of the children. But we also do that as well directly with our clients. I remember a case a couple of years ago where we had a young man who came to us, and he was put into foster care because he ended up going into the hospital multiple times for severe diabetes. It was not managed diabetes. And it turned out that, he had a single mom who didn't have all the resources that my family had, who really didn't quite understand how to manage diabetes. And I don't know if you know anything about it, but you almost need a math degree to calculate the carbs and all of these kinds of things. I worked with a registered dietitian for a year to learn how to, and again, wow. I have all of the resources to learn how to manage that. So we figured out that if we taught this young boy how to manage his own diabetes, he could be reunited with his mom. because there wasn't really anything that she did incorrectly. She just couldn't figure out how to manage his diabetes. So our nurse worked with him, our foster parents worked with him, and then they also worked with his biological mom. And once he was able to get his diabetes under control, he was able to reunite with his family. And those are the types of things that we want to do. You know, Walden, we would love to put ourselves out of business. We would love to no longer have a need for foster care in our country because children belong with their families if at all possible. We just need to give the families the tools that they need to care for their children. And that's a big part of what we do. But in the instance where those families can't do it, about 65% of our children are able to successfully reunite with a family member, a mom, a dad, a grandma, an aunt, an uncle. But for those who can't, then we find loving adoptive families. And again, when you come to Walden to adopt a child, you know, if someone says, I want a young, healthy, newborn infant, when we say, well, you know, Walden's not a great place for you, let us refer you. And we refer probably about 70% of the folks who call us to adopt. We say, if you're interested in adopting a child who's medically fragile, possibly on hospice, or who may have developmental delays, they may be part of a large sibling group and we want to keep them together. They may be older children. You know, there are a lot of older teens out there still waiting for their forever family. Just because you're 17 doesn't mean you don't want a forever family. So when they call us, if those are the children that they're willing to open their hearts and their homes to, then Walden is a really good fit for that.
Think of the traditional foster service or system. They don't necessarily realize all the different levels of support that you can provide. You mentioned, you know, some guidance and education that you provided to a certain family about a medical condition. And you mentioned a few other things that, you know, is within your portfolio to help get these young children, these children in general, back into a caring home. Help us understand the spectrum of services that you provide with, I'm sure, the end goal of being getting this child the care that he needs or she needs so that they have a successful, rewarding life, high quality of life. But kind of work, for those that don't know, haven't been exposed to this part of the community, share a little bit more about the different levels of service, different types of support that you provide, not just children, but potential families.
Yes, absolutely. Well, Walden takes care of children from ages newborn all the way up to 24 when they become young adults. And so the spectrum of services is that they may come to us from the ages of 0 to 18 in foster care. And as I mentioned, the goal is reunification. So our foster parents are specifically trained to work with biological families and mentor them and guide them and teach them about what a healthy family looks like. But they also work directly with the youth. And then we have a whole wraparound team that works also with both the foster family and the youth. That includes peer parents for foster parents who've been through similar experience. It means peer partners for our youth, people with lived experience who may have grown up in the foster care system themselves. And they can guide the children and the youth that we serve. And it's everything that they need. Again, our nurse, our licensed clinicians, whatever tools that the children and the families need, we're available 24/7. Because, you know, as a parent, you know that problems don't happen Monday through Friday from 9 to 5, right? They happen at all hours, holidays, et cetera. And Walden is open during that whole time. I mean, we're working hard. We even place children Christmas Eve, New Year's Eve, Christmas Day. You know, we get calls all the time, at any time. And we're available at that time to help our clients and our families in need. But if the children, as I mentioned, don't get reunified, then we will work with an adopted family to take the child into their home. And again, we provide those same types of services for as long as the family wants. So if they want to keep connected with us, they're welcome every year to come to our annual holiday party, to come to our summer picnic, you know, those types of services, to reconnect so that their children can meet other adopted children who've had similar experiences. But then we also have a program from 18 to 24 for those youth who outside of Walden didn't get reunited, didn't get adopted. They aged out of the foster care system. And statistically, if you look at what happens to those youth when they age out of the foster care at 18, the stats are very dismal. Within a year, young women will become pregnant. Young men will become incarcerated. Both have unfortunately a very high instance of homelessness, etc. So we saw that happening decades ago. So we started lobbying here in California with other similar organizations for the state of California. And we finally got AB 12 passed about 10 years ago, about 12 years ago, actually now, where youth who were 18, rather than aging out, they had 3 different options. They could continue to stay with their foster parents at the age of 18. They could B, move into a place of their own through help with someone like Walden, where we connected with them, did intensive case management, or C, they could go into like a college or something and still had some support in that area. And we felt it was really important because the research shows that young men and women, just because they turn 18 doesn't automatically mean they're mature enough to take care of themselves. I should know. I have a 23-year-old and a 25-year-old boy, and some of the texts that I get asking me questions about how to do things, I'm like, yeah, young people don't mature automatically overnight at the age of 18. So we have this program from 18 to 24 to continue to provide the case management to them to act as their parents, just like their parents would, help them when they try to go to college, when they try to find a job, when they get their first apartment, when they're learning how to cook and clean and buy groceries, when they're learning how to open a bank account. All the things that I did for my young boys as they became adults, Walden does that for these young folks, because that is the only way we're going to prevent homelessness and incarceration of this population. It is the only way. Prevention is the key by working with them rather than trying to do this after the fact. Sure, you can go to someone who's now 40 years old and they're on the streets and work with them. And of course, we're going to do that. But if you work with them earlier and prevent them from going on the streets, it not only is better for that person, but it's better for society as a whole. And most importantly, we can stop the cycle of child abuse, neglect, poverty right then and there. And we've seen the stats. You know, I have a young person who works with us. She's fantastic, and she has lived experience. She grew up in foster care, and she grew up with a foster family agency. But her older brothers and sisters didn't. They grew up with the county. And unfortunately, her older brothers and sisters repeated the cycle. So her nieces and nephews are in foster care. But this amazing young woman she grew up in a foster family agency and had the individualized treatment and plans that an organization like Walden provides. And she's right now one of the less than 3% nationally of foster youth who've graduated with a bachelor's degree. And she's got double majored, criminal justice and sociology, you know, and that's literally only 3% of foster youth in the nation.
Wow.
Get a master's degree. I mean, a bachelor's degree. And now she's actually applying for her master's degree. Less than 1% nationally will go on to graduate school as well. So those are the types of stories we want to see. And she is the only one in her family that doesn't have children who are in foster care. So basically, through being raised in a foster family organization, she broke the cycle of child abuse and neglect. And society as a whole has benefited because she has done amazing work in the last 10 years working in the nonprofit world and helping other foster children. And that's what Walden is all about.
What a great resource to have. And that life experience, I'm sure, helped her relate on a whole different level. If I were to assume, I would assume that that's how you've probably seen, you know, the foster care system and services evolve over time, where we're starting to realize now, not just based on data, but also anecdotally that, you know, these families, these young people, they need more than, you know, the black and white well, they're in a home, they're getting 3 meals a day. They need more than that. They need education, they need guidance, they need positive examples and role models. And then they need continued support past that 18th birthday. And elaborate a little bit on how you've seen, this part of our community evolve over time. And then if you have a vision that, 5-10 years from now, where we will continue to evolve to, share that with us too.
Yeah, absolutely. Well, as you said, foster care has really evolved since Walden started in 1976. And in fact, we started out with group homes and children living in institutions. And that was a very profitable way for Walden to start out. But we saw that the stats were really dismal for youth when they left our group homes. So we quickly pivoted to having children live with families, because all the research, as you mentioned, shows both data and anecdotally that children do better in a family situation. And then, as I mentioned, we pushed to be able to have those youth stay into foster care up until the age of 24. And then we started moving into the transitional age youth and providing housing, guidance, education, employment, workforce training, and so forth. What we see for the future is, particularly here in California, is we have a huge housing crisis. Young people, whether you're in foster care or not, it's really unaffordable in Southern California. Even my own oldest, with a master's degree and a very good paying job, lives with roommates. And because of the housing crisis. And not only that, but when he was trying to get a place in the first place, he was turned down by maybe 8 other apartments. People can pick and choose who come and live in their apartments. So we have a huge housing crisis. So Walden is now moving into that area. It's not an area we thought we would ever be in, but because we can't find enough affordable places for our foster youth to move into at the ages of 18 to 24. And again, that's why we have so many unhoused people in California, because of our skyrocketing rents. So housing is going to be a big area for us. We're actually in the process of purchasing our own properties so that we can manage, because even Walden, we have leases all over Southern California to house our transitional age youth. But even the landlords are turning us away, and they're, saying, oh, we're going to turn this into a luxury building where a 1-bedroom apartment goes for $3,500. Mm-hmm. It's just not affordable. It's not sustainable. So we're now purchasing our own property so that we can place the youth in it. We're not going to be subject to the whims of the landlords, and these big corporations who are, rightly so, but as is their right, but we just can't afford it. The other area that we're moving into, because we see that this is a huge societal problem, but particularly for former foster youth, is we're expanding our mental health programs. Our mental health crisis in California has skyrocketed, particularly since the pandemic. We thought it was bad before the pandemic, but since the pandemic, it has skyrocketed, with school closures, people being stuck at home, people being isolated. When the schools opened up, we saw a huge influx of kids coming into foster care because of the stressors that the parents, had to deal with losing jobs, homeschooling, all of those kinds of things. Unfortunately, it was taken out on the children in their homes. So we're seeing a huge mental health crisis of people of all ages, the children and the youth that we serve, but also a lot of the parents that we serve in our parenting program. So we are expanding our mental health program so that parents can get the treatment that they need and they can reunite or keep their children in their homes. So we really think that Walden needs to focus on housing and mental health because of the crisis that we have here in California. And we think that's the best way to keep people off the streets and out of institutions. Yeah, and around, continued support and community. The mental health thing I want to get a little deeper on, because, we talk about in healthcare, we talk about at-risk populations all the time. During the COVID pandemic, that was a natural topic, right? It was, okay, what populations are at a higher risk just because of health history,
physical condition, age, all of those things. And there was a lot of support directed towards that higher risk or at-risk population. When we're talking about mental health, when we're thinking about mental health, it's common sense to me to see this foster care population, these kids, these young people, as higher risk for mental health challenges because of all of the experiences that they've been through. And I'm sure there's a higher prevalence, especially when isolated during the pandemic. There's a higher prevalence of these challenges, these mental health concerns for the young people that are in the system.
Yeah, absolutely. I think the pandemic had to be the biggest challenge that Walden faced in our history since 1976. It was just horrific. And I can't even imagine going through that again. But as you said, the isolation, our children already come to us with a lot of trauma in their life. They've been removed from their home, their family, the only family that they knew. And even if it was not the ideal situation, that's their family and that's who they love. And then they're placed with strangers or sometimes in institutions, depending on if there are enough foster homes, which unfortunately there aren't. So then during the pandemic, but they learn to adapt, and foster children are resilient if they get the care and the love and the support that they need. But during the pandemic, it was really, really hard. I'm so incredibly proud of our team. We were open 24/7. Our doors never closed during the pandemic. We had to pivot and try and provide, for instance, our visits. We still continued our weekly visits, but we tried to move them outdoors. We're pretty fortunate to live in California where we're able to do that. But we still had weekly visits in person, but we increased our other types of check-ins, with the older youth. It might be a text or a FaceTime, or a Zoom. We had to increase that because we knew that our children were going to be at higher risk. And also the foster parents. They didn't sign up for homeschooling their children and taking care of them in the home 24/7 and having to do their day jobs as well. So we needed to take care of our foster parents as well. So, that meant that we were dropping off food and, all medicine. We were helping with transportation to testing sites and hospitals. But yeah, we had to take a larger number of children and youth for mental health, who are in mental health crises, to the hospitals than we ever have before. And it was very difficult and it was very sad. But luckily, our staff, we get a lot of training in our industry, a lot of required training. And we have a lot of licensed clinicians. We have an excellent woman, Latoya, who runs our mental health department. And so we were prepared for this, and we pulled through as a team. And I'm very incredibly proud of our social workers, all of our direct care staff, our board members, our volunteers, but most importantly, the donors who stepped up. We had people driving around, donors, and helping us find toilet paper at the time because
I remember those days. Yeah.
Right? Yeah. Because our older youth, 18 to 24, they were isolated in their apartments. Nobody has any transportation. They take public transportation. You couldn't have them take a bus and go from store to store to store and look for toilet paper and canned goods. So our volunteers and our board members mobilized and provided those things so that we could take them out to them on a weekly basis, to everybody. But yeah, the mental health crisis really expanded, and we thought it would, once things opened up, we thought it would die down a little bit, but it really hasn't. And that's why we're expanding our mental health program to continue to provide these services to everyone who needs it. And we have a robust mental health program for our own staff as well, because, we're people too. So while we were trying to take care of our foster children, youth, and families, we had our own issues going on. I personally suffered really greatly from long COVID. We experienced a lot of deaths and a lot of trauma. Some of our social workers, spouses died, my personal friends, some of my friends died, a lot of bad things happened. So we had to take care of ourselves as well. And I remember, before this happened, we made sure all of our staff had our healthcare app on our phones, so that in case we got COVID or whatever happened. And I remember waking up in the middle of the night thinking, this is unmanageable. And I know enough about mental health care to know when I need help, right? Because this is what I do for a living. So I called, on my app, I got in touch with a psychiatrist in the middle of the night. And I said, I think I need some help. I am burned out. I'm overrun. I have long COVID, and I'm struggling to make sure that the 1,500 children, youth, and families that we serve are okay. And so I myself contacted a psychiatrist and said, please help me so I can help others. And I think that's the important thing, is making sure that our team are aware that they know that they have support as well. They are humans and they need to take care of themselves. So as we talked about, self-care is so important.
Yeah. And having access to that care. And for this community and your employees, the stress, all of those things that go into this job and this community's lives, access to that care is really important. How do families get involved? If I'm listening to this podcast and I'm thinking, well, this is a great mission, it's a great purpose. I don't know if it's for me. I'm not capable or qualified to be, a part of this community as a parent, as a foster parent, as a foster family. What would your message be to that community? How do they get involved, and what encouragement would you give them to take an interest and be a part of it?
Well, not everybody can be a foster parent, but everybody can help a foster child. And there are a number of ways. As we discussed before, there are 100,000 American children waiting to be adopted from foster care, 100,000. And you may not be able to adopt or bring one of these children into your home, but you may know somebody who is. So help us spread the word. No matter what state, what county you live in, help us spread the word. Talk to your church, talk to your school, talk to your book club, talk to anybody about the need for foster and adoptive parents, because we are in crisis in the United States. There aren't enough for the children in this country who need a loving family and a home. So help us spread the message. Become an evangelist. Become a foster care and adoption evangelist is what I say. And you can do that through social media. Anytime you're out to dinner with someone saying, hey, have you heard about this organization in our local town? They do foster care and adoption. Have you thought about bringing someone, into your home? That's the number one thing, is help us spread the word. But number two, everyone can volunteer. We have fabulous volunteers. As I said, during the pandemic, they helped us with toilet paper and canned food and all of those kinds of things. But in a regular year, they help us with holiday and birthday gifts for our kids, to make sure that our kids know that they are loved. They help us with backpacks and school drives. They may host a golf tournament and make us the beneficiary. Churches, there was a church last year that put on a foster family picnic and hosted all of our kids, and they had carnivals and games and a petting zoo and food, and it was so much fun. Those are the types of things that volunteers can do, and we need that. Every organization, not just Walden, in your local community needs the volunteers. They are the lifeblood of an organization like Walden. So, and if you can't do that, then donate. Go to waldenfamily.org, look for ways to donate, volunteer. And if you're not in Southern California, look for your local organization, because I can guarantee you that they need your help. I know that, during the big flood in Texas, one year, we reached out to a sister foster care agency there, and we said, what can we do to help? Because, their families were impacted. And we had a drive here in California, and we raised money for a sister agency in Texas. So there are so many ways to support an organization, and we like to support each other as well.
I think it goes back to taking a village. Walden's is providing a great service, and but you can't do it yourself. It's going to take volunteers, donors. It's going to take legislation in the government stepping up and supporting not only organizations like Walden, but also the children that are part of the community, and the foster families that have stepped up to be a foster family or an adoptive family. And
they are literally angels on earth. I say that foster and adoptive families are literally angels on earth. I mean, they are heroes who don't wear capes. And I just can't tell you how grateful we are that they're willing to open their hearts and their homes, particularly, as I mentioned, for us, because we serve medically fragile children, those with developmental delays and mental health and behavioral challenges. And, it takes a strong person, and our foster and adoptive families are amazing.
That's healthcare in general, and it takes everybody. And, it also takes people to realize it's not about ourselves. And, we were put here to help everybody and to be a part of a community that lends a helping hand to those who can't do it themselves. And so Teresa, I can't thank you enough for not only the services that you provide, the organization that you run, but also for being on the show and evangelizing yourself about the need, the challenges, the opportunity that we have for these young adults and these young people. So thank you for everything.
Thank you. I appreciate it. Thank you.